Hello dear friends, my name is Dr. Igor, I'm clinical oncologist practicing since 2010. Today we are continuing our playlist on vitamins, and there is another water-soluble vitamin that is B12, very important, very interesting. If you look at its structure, chemical structure, it's very big, and in the center there is cobalt. They can be hydroxycobalamin, the cyanocobalamin, methylcobalamin, and they will convert to each other easily. You can get vitamin B12 from diet. It's animal products. It's meat, fish, eggs, dairy, poultry, liver, kidney, heart. And let's talk about the deficit and treatment of the deficit after the intro. Vitamin B12 is needed for many things in our body. For example, for normal synthesis of our red blood cells that are important to bring oxygen to our tissues. If we don't have enough vitamin B12, we get macrocytic anemia, when the red blood cells become big. And when we have anemia, we have, of course, weakness, pallor, and all other symptoms of anemia. The other thing is neuropathy. As it's very important for our neural system, we will start to have the peripheral neuropathy. Peripheral nerves will suffer, and you can get tingling, numbness, or weakness of your extremities or other parts of the body. Also, it can affect the central neural system. For example, brain, and it can cause some dementia, or it can cause the optic neuritis that will affect your vision. Also, it can cause the damage to the spinal cord. It's called subacute combined spinal degeneration. Also, it's worth talking about homocysteine. Homocysteine is the amino acid that is the product of other amino acids metabolism, like methionine and cysteine. And homocysteine is increase is associated with enhanced atherosclerosis, with enhanced problems with blood vessels, complications like stroke or myocardial infarction or thrombosis, emboli. That's why we often measure homocysteine together with a vitamin B12 or folate, for example. And high level of homocysteine usually are associated with low levels of B12 or folate or B6, and many of these conditions with high level of homocysteine we will treat with B12 or folate supplementation. But you must always talk to your doctor about whether this treatment is necessary for you or not. Some good news for you. We have good storage abilities in our body. Our liver stores 90% of vitamin B12, and if the patient's stomach is removed for some reasons, then the storages are enough for 3 to 5 years. And that's why when you're taking supplements, you will need to take it for a long time. If it's per oral, for example, for several months, until you replenish the storages. And healthy human needs approximately from 3 to 5 micrograms of vitamin B12 a day. And let's talk about the reasons for vitamin B12 deficiency. And let's start from something more rare, and it's diet. For example, if you don't get enough B12 from your diet, whom I'm speaking about? I'm speaking about the vegans who have strict restriction from animal products. We know that only animal products contain B12. That's why they may need some supplementation of vitamin B12 to prevent those anemia or neural problems or high homocysteine in their blood. The other reason may be enhanced needs. For example, growing adolescents and kids or pregnant women, they may sometimes also have some deficit, but mostly if the person is healthy, he still can get all the needed vitamin B12 from the diet. And let's talk about more common reasons now. The most common reason is malabsorption, decreased absorption of vitamin B12. When does it happen? First of all, to absorb vitamin B12, we need the special protein called internal factor. And this is produced in our mucosa of our stomach. If the person has some problems with the stomach, then this factor, internal factor, will be produced. And the person will have deficiency. What can happen to stomach? For example, it can be autoimmune gastritis, or it can be atrophic gastritis, or the stomach may be removed, and then this internal factor is not produced, because it must produce form their stable complex with B12, and then the stable complex goes down within the gut, and in the last part of the small intestine, it will be absorbed. And then it goes to the body, it goes to the liver for storage. If it doesn't happen, the patient may become deficient. The second, as you already understand, is problems with this small intestine, the ileum. For example, it can be Crohn's disease or some surgical removal of ileum. Also, the bacterial overgrowth may cause problems with B12. Also, the parasites like Diphyllobotrium platum that you can get from fish consumption. And it's worth mentioning that chronic intake of some drugs like metformin for diabetes can also cause B12 deficiency. And if we talk about the treatment of deficiency, usually we can replenish B12 if we do intramuscular injections or we take per-oral drugs. If we need it faster, if there is something serious, it's better to do injections. For example, there is one scheme to do 1,000 micrograms per day intramuscular injections of vitamin B for 1 week, or every other day for 1 week. Then 2 months we do it once a week, and then we do it once in 3 weeks. Or in some cases we can take it through our mouths for 1,000 to 2,000 micrograms a day. Do you need this supplementation, or which form is better for you? You should discuss with your doctor. Dear friends, that's all for today. I hope it was interesting for you, and in the next video we'll talk about the other very important drug called folic acid. My name is Dr. Igor. See you, bye-bye.